Hi, I'm going to talk about something that's not quite as common, and that's numbness in the back of the hand. And it's sometimes called radial nerve syndrome, and it affects the radial nerve. And where it affects is the thumb, sometimes down past the wrist, even into the forearm a little bit. The first finger and the second finger usually only goes up to the knuckle, but in the whole back of the hand can be tingling or numb, and that's caused generally by a muscle called the supinator. And what the supinator does is it turns your hand up. The pronator teres that we talked about before turns your hand down. This one turns your hand face up. And it's not as common of a problem because most of us work with our hands down, piano playing, typing, whatever. But certain professions, they turn their hands over a lot, like you might be unscrewing stuff, depending on if you're right hand or left hand, whether you're screwing or unscrewing, turning knobs, turning bricks over, turning cards over, turning whatever over, or you're pulling up nails. Had a roofer, he wasn't a roofer, he was a weekend roofer. He worked for a couple days pulling nails off a roof, and freaked him out because the back of his hand was numb, and you know, I always think of muscle problems as happening slowly, gradually over a period of time, but they can happen all of a sudden too if you're doing an activity that you're not used to. You've already maybe got tight muscles from something else, and then you add on a different activity, and suddenly you've got numbness in your hands, and you're going, ah! Whereas someone who's had that problem come and go, they're not as worried about it as if someone all of a sudden freaks them out. But anyway, that's caused by a muscle called the supinator, and I'll show you how to work on that yourself. Okay, so how to work on this yourself. You've got a padded surface. You can have towels on top of a table. In this case, I've just got a pillow on the back of the chair, which is probably not the best way, but you want your arm fairly straight because you don't want the biceps interfering. And you use the other elbow, but not the pointy part, but right next to it, because the pointy part can bruise you easily. And it's a deep muscle, and you want to be working on the thumb side and have your elbow more on the back side of the arm and kind of push in into your arm. And as you do that, turn your hand over, so I'm pushing in towards my body with my elbow as I turn my hand face up, palm up. Release, turn the palm up, turn the palm up, and you want to work as deep as comfortable. And the more it hurts, the more of a problem you've got, but you want to work at a pressure that's tolerable, and as you do it more and more, that tenderness will go away as the muscle loosens up. It always amazes me if someone says, I tried it, it hurts. Well, who's doing the pressure? You are. Lighten up, you know. But if you can go deeper than what you're doing, go deeper, as long as you know, you can tolerate it. You know? Use the pressure that's right for you. Like I said, if a muscle is perfectly happy, you'll feel absolutely no tenderness. You can push as hard as you want, you'll just feel pressure. But the happier muscle is, you know, it feels good to, yeah. Anyway, if you can see what I'm doing, just push right there, turn the muscle over. You should be able to feel, if you're pushing with your hand, to feel that muscle move as you're turning your hand. But you don't want to ruin your hands by pushing on that, because you don't have a lot of leverage with your hands here. And you can do it for a couple minutes and come back to it later.